The World Health Organization is calling for countries to act now as the number of coronavirus cases tops 370,000 globally. Hello, I'm Anand Naidu, and this is The Heat. The Director General of the WHO says the number of COVID-19 cases can only be described as heartbreaking and is urging countries to do more. The coronavirus has spread to more than 175 countries and territories across the globe. Here in the United States, tens of millions of Americans have been ordered to stay home. But Italy continues to be a major concern with some of the highest number of cases anywhere. Earlier, I spoke with Seema Gupta, a journalist based in Rome, and asked her how the response to the pandemic is changing.
Well, yes. I mean, if you look at the response in terms of the so-called lockdown measures or the measures to contain and limit the spread of COVID-19, it's interesting to see the progression. Initially, there were these so-called 11 towns up north where they saw a spike in cases and they locked down those 11 towns. And then eventually it became those northern regions of Lombardy and Emilia-Romagna and so on, affecting some 16 million people, and then eventually that was followed up with the step of putting the entire country on lockdown, and that's 60 million people. So some do suggest and are critical, saying that perhaps these figures of the number of deaths and the number of infections that we've seen could have been contained if the lockdown measures were put in place earlier. On top of that, there's also this feeling that when you look at the impact that all of this has had on the health system in the country, that's another issue of why we've seen these high number of deaths, because of course the medical staff, particularly up north in the hardest hit regions, particularly in Lombardy, they're working to the point of exhaustion non-stop. And we've seen some 4,800 doctors or so that are infected themselves. And so this, of course, has led to increasing infections and increasing deaths when the health system is overwhelmed. But the main reason that the authorities say that we've seen these large figures is because of Italy's elderly population. A quarter of the population is over the age of 65, and the average age of those who have died is above 70. And so that's part of the reason why this disease, which seems to target the fragile and vulnerable in the society, seems to have targeted the Italian population in particular so dramatically.
That's right. We have seen these very traumatic, very distressing pictures of doctors, nurses, healthcare workers working long hours, stretched to the limit, pictures of fatigue. How badly has the healthcare system in Italy been overwhelmed by this?
Well, they're trying to do everything they can to support the system. I think it's important to note that Lombardy in particular has a public health system that is world class. It's considered one of the best places in Italy in terms of how well equipped it is. And people often from the south, where it's not as well equipped, they travel there to get their health treatment. So that was a region that did have everything in place. That said, there have been cuts to the health system in recent years. Cuts as in various countries around the world, and that may have had some kind of impact. But I think it's also the speed at which this COVID-19 virus infects others and has the impact on the population because of this. And so it's simply a situation where the doctors are not enough. The equipment, the masks, the ventilators, the protective suits are just not enough on hand for them to deal with it. And so what they've done in Lombardy in particular, they've moved people who are in the intensive care units, people who are not dealing with coronavirus, but now even people who are suffering from the coronavirus, they've moved them out of the region to other hospitals in Italy. The Prime Minister made a call for at least 300 volunteers, doctors from other parts of the region to travel up north. He was overwhelmed. He got close to 8,000 volunteering to go up there. And then, of course, they're also turning to the production of those masks as well as ventilators. To give you an idea, Ferrari, the car manufacturer, is actually turning to now producing ventilators. And there has been response from abroad as well. We've seen 300 medical experts and doctors arrive from China together with equipment and and those masks and protective suits. We've also seen arrival of doctors from Cuba and also more recently from Russia as well.
As far as the lockdown is concerned, Seema, are Italians respecting the restrictions on travel and on gatherings?
I think for the most part, Italians, and especially for me here in Rome, I can see that people are following the restrictions. When it comes to social distancing, when you walk down the street, you tend to avoid the person that's next to you. In the supermarkets, there are long lines simply because there's a limit to how many can be in the supermarket. And in the line, everybody respects that 1 meter distance. That said, though, there are still people who are breaking are committing violations and not sticking to these lockdown measures, particularly just on Sunday, for example, there were 10,000 violations, even though the measures have been increasing and becoming more and more stringent. I think one of the reasons is perhaps there is a bit of disparity, or it's not been very clear the message of how exactly these measures should be implemented. And then, of course, you have the elderly population. I'm hearing stories about how they're used to their ways and habits, and they find these measures restrictive. But the authorities are insisting on their message to stay at home.
This is so unprecedented. Everything has happened so quickly. How are people in Italy dealing with this emotionally?
I think it's been very hard. It's really been a hit to the gut, really, to see these dramatic numbers and dramatic stories. The fact that you can have the virus and not know it and just spread it and impact your loved ones, your parents and your grandparents, since it impacts the elderly so unproportionately. That's, I think, what's taken people by surprise. That said, I think many Italians feel a sense of solidarity. They feel they have to do what they can in order to help the healthcare workers and help those that are dealing with this. At the same time, they feel frustrated because they're simply stuck at home. And that's why we've seen these flash mobs where people have come out onto their balconies, onto their windows to sing, to clap their hands and applaud the healthcare workers. You've got children painting these rainbows and the hashtag of this tagline, Andrà tutto bene, which simply means everything will be all right. I think it's their way to express that kind of solidarity. That said, honestly, it's not easy being stuck at home, and families are having to deal with continuing their work schedule, but also dealing with their children. But that's just a simple sacrifice to make. The real issue is everyone is concerned about their own health, but the health of their fellow citizens as well.
Looking at another aspect of this, and that is the economic impact, the Italian Prime Minister Giuseppe Conte, he has announced the closure of all non-essential factories. This is what he had to say. Let's listen.
We're slowing down the country's productive engine, but we are not stopping it. It is not an easy decision, but a decision that allows us, predisposes us to face the most acute phase of the contagion. It is a decision that is necessary today, in particular, to be able to contain the spread of the epidemic as much as possible.
So, Seema, what impact is this having, especially on workers?
Yes, I mean, initially there were, in fact, some reactions about the fact that workers felt it was unfair that they were putting themselves at risk by being made to go to work to these factories when there was such a situation of contagion. That said, the government stepped in by saying they would provide the masks and the protective gear in terms of gloves, and that factories had to function keeping to the social distancing norms. That means perhaps cutting down on the number of workers and shifting the hours. In the end, though, the decision was made to shut all non-essential production simply because the authorities felt they needed to put the health of the people in place and in priority, particularly when you consider the fact that people have to come and go to work. So it's that movement that they're trying to limit. The workers, some of them want the greater protection. In terms of the employers association, some are saying that this is going to have a dramatic effect on the economy here in Italy. With production down, already you have a stagnant economy here in Italy. This is just going to have a massive impact altogether. And there is fear from the part of employers that this is going to be a downfall for their companies and the way they're going to be able to function. They're also looking at what happens when we and get out of this phase, hopefully we will, what will happen to the future of the economy of the country, which is why the Prime Minister had put in place that package of 25 billion euros in terms of economic measures. But is that really going to be enough? We'll have to see what happens in the coming days and weeks. But for the moment, as the Prime Minister said, and as most people in Italy feel, health issues have to take the priority.
This bailout package that you're talking about, is it aimed primarily at helping companies, or is there some kind of safety net put in place for individuals and for families?
It's also for individuals and families. It's also for the medical staff and the healthcare workers that need the help. They need the help in order to carry out the important work that they do. But in terms of families, for instance, helping them out in terms of actual money or child minding help, simply if they have to go to work, how can they be at the same time looking after their children as all the schools are closed? There's also help specifically for autonomous workers, the self-employed. What are they going to do because they're simply out of work? So there are all these several packages that are in place to help workers to tide over this period, and hopefully it will help somewhat. But that said, I think a lot of Italians are very nervous about what this means for their livelihoods and for their jobs, and they're sitting at home and wondering what it's going to mean for the future.
Seema, we've had so many stories from Italy about the heroism, the bravery, the courage of healthcare workers and ordinary Italians themselves. But is there any single story that has really struck you, a story of perseverance that got your attention?
I have to say, just speaking visually, I think one of the things that really struck me was a photo early on where you saw an image of an exhausted nurse, and she just had her head flat down on a laptop, and she was still wearing her mask and her protective gear, and it was just so powerful an image to show the extent to which they're actually in the front line in this battle and having to deal with it, putting themselves at risk, and at the same time working to the bare bone. And really, I think the overwhelming response in Italy, in other countries as well, but I've seen personally here in Italy where most people feel an immense gratitude to them. And at the same time, there's also been some frustration that not more was done in the past to support the medical fraternity, the nurses, the hospital staff, and the doctors, and also helping them in terms of getting the protective gear. One person even suggested, what's the point of getting all these doctors to come in if you can't ensure that they're protected themselves from the virus? As I mentioned, 4,824 doctors are themselves infected now.
Seema, thanks so much for joining us. That was journalist Seema Gupta talking to me earlier from Rome. Well, for more now on the global impact of the coronavirus, let's bring in our panel. Joining us from Seoul in the Republic of Korea is Leanne Yu. She's a professor of Korean history at Korea University. Also with us from Dallas, Texas is Danielle DiMartino Booth. She's the CEO and chief strategist of Quill Intelligence, a research and analytics firm. And Dr. Lauren Miller is an investigator with the Lundquist Institute and professor of medicine at the University of California in Los Angeles. And Dr. Miller, I want to start with you, and I want to start with something that is happening right now. The president and his team have been addressing the nation from the White House, as they do on a daily basis, with an update on the coronavirus outbreak. Something the president said earlier on, he appears to be very keen on the idea of, in his words, to reopen the economy sooner rather than later. He said he will make that decision once he's reviewed the situation after a 15-day period. We're now in the 8th day of that 15-day period, so it's 7 days more. Let's listen to part of what the president had to say.
America will again and soon be open for business, very soon, a lot sooner than 3 or 4 months that somebody was suggesting. A lot sooner. We cannot let the cure be worse than the problem itself. We're not going to let the cure be worse than the problem.
So, Dr. Miller, what do you make of that? Would that be too soon?
Well, I think the devil's in the details. Really depends on how soon really is. I think at this point in time, there's a lot that's unknown about the spread of COVID-19 in the United States. So I think before someone, be it the president or others, think about, quote, reopening the economy, that we have a better idea of the level of spread and all parts of the United States. So I think time will tell, but I understand what the president's trying to say is like to open sooner than later, but I think a cautious approach to understanding the spread would be the first step before any other changes would be done.
Daniel, what are your thoughts on starting the economy, getting the economy going again? We know that the economy has taken a huge hit over the past few weeks. The stock market has taken a bashing. It's way down. Do you see any sense in what the president is suggesting here?
Well, I think that there's a certain amount of frustration. There should be frustration in the fact that the economy has come to a sudden stop. But by the same token, if you speak to doctors, as we've just been hearing, until we understand how this virus maps out, we know that it started on the West Coast, moved to the East Coast, where it's acute right now in New York, but is also spreading to the interior of the country. Until we get a lot more people tested, I think it's premature to say that we're going to pass some benchmark in 7 days' time when they've only just, the Vice President Pence had just said that we've only tested just north of 300,000 Americans, and we've got over 40 some odd thousand cases from those 300,000 tests. So these are tremendous numbers that are indicative, in my view. Again, I cover the economy, but if you were to have, after 7 days, the spread continue or even accelerate because there was a premature return to try and get the economy back up and running, that would deal a second body blow to the economy. I think the best thing to do in order to get past where we are the most expeditiously is to finish the testing process for those we know to be symptomatic.
All right, let me bring in Leanne from Seoul. And Leanne, talking about testing, South Korea just reported its lowest number of coronavirus cases since a peak on February 29th. In fact, the Korea Centers for Disease Control reported 64 new cases on Monday. How did South Korea take control of this in a relatively short space of time?
Well, there are several different factors that are involved. First, if we look historically, South Korea has had experience with both SARS and MERS. And so having this experience for the public, at least, things like washing your hands and wearing a mask and social distancing, these were all very familiar to the Korean public. And so it was rather easy to mobilize. Secondly, I would say that the widespread availability of testing, that was also very important. The healthcare system here in South Korea is set up in such a way that it's very accessible and affordable to receive medical attention. And so anyone who wanted to get a test was able to do so. And the government was also able to mobilize resources, both public and private, in such a way that testing was done expeditiously and that the test results were given right away. But I think most importantly, one of the reasons why the South Korean case has been successful is because of the transparency and availability of information. So the government disclosed information to the public regularly, twice daily, and there were all kinds of messages that were sent out to the public via cell phones. And so this full disclosure of information really allowed the public to make informed decisions. They knew which areas to avoid since these infected patients were tracked and their whereabouts were made known to the public, and also because of this information available, that the public was able to then also mobilize their own resources and to take action. And so I think it's a combination of all of these factors that has led to this success.
Right, and Leanne, I guess people were, as you say, testing was carried out expeditiously. People were able to get testing because there was a stockpile of tests in the country, or test kits.
That's right. So That's right. So again, given the history here in South Korea, there has been a certain amount of preparation that was involved, and then also because the public understands the importance of early testing and early detection, the government was able to mobilize people, and anybody who was in any kind of infected area or potentially had contact with an infected person, they were able to have access to testing. And then also the government was very creative in making these tests available. So the drive-through testing, the mobile applications for self-screening, the government understood that given the evolving situation that it was important to be flexible.
Right, Dr. Miller, I'm wondering how much of a challenge is it to get the public to comply with what the experts, the epidemiologists have been telling us, that you have to stay home, stay put, stay in place, stay where you are. I mean, if you look at the situation here in Washington, D.C., where I am right now, people were heading to the Tidal Basin, which is just down the road from where I'm sitting right now, for the annual Cherry Blossom Festival, and there were crowds there. People were packed into that area. Where you are in Los Angeles, I've seen reports where golf courses had to be closed, where beach parking had to be shut down because people just ignored these calls to socially distance themselves and headed down to these places. I mean, how big a challenge is that if we are going to get this under control?
Yeah, so I think it obviously is a big challenge. This is a very alien concept to be shut down to Americans. And there have been increasing local demands by counties, cities, and later the state getting involved. And my sense is in the beginning, some people heeded these warnings, but only after repeated and increasing severity of warnings that people are really beginning to understand that this is a big deal. I must say that when you look in Los Angeles, the freeways are relatively uncrowded, which is highly unusual for us, and that stores are closed, people are really staying indoors. So I think it's begun to truly penetrate locally here in Los Angeles and Southern California. I can't say much for the rest of the nation because I'm obviously not there, but I think it's the repeated and increasingly stern warnings that we've been getting from our leaders. And I think at this point in time, most people are heeding the authorities.
Right. Daniel, if you look at what's happening here at the U.S. Congress, they're trying to push through some packages right now to help business in this country to keep the economy on track. But there's two sides to this, because the former U.S. Secretary of Labor, Robert Reich, is calling on the U.S. Congress to help workers, not corporations. He says, and this is something he tweeted, he says, no industry, not airlines, not hotels, not cruise ships, should be bailed out. They can stay in business by borrowing at rock-bottom rates using their assets as collateral. Taxpayer money should bail out people, not corporations. What do you make of that?
Well, I mean, he's speaking for a large contingency of the population who does not buy into the of a national security interest type of argument that you would apply for an American Airlines or a United or a Delta, to say it's in the national interest to keep these companies in business. But I think that there can be a rational and balanced approach to the bill that Congress passes that does indeed focus most on the largest employer in the United States, which is small businesses, and again, getting money directly to the people who are affected and out of a job immediately because stores are closed, because restaurants bookings are down almost 100%. In a matter of days. These are all very small businesses and people who are going to have to be concerned about putting food on their own table with their families while they're shut in. So, but again, I think that there has to be a balance. Can there be such things as the slush fund? That's the term that's been bandied about, and you know, no type of accountability for companies that are going to be getting assistance from the U.S. government. You know, given the aftermath and how divided the country is after the financial crisis, I would say the answer to that should be a resolute no. There has to be accountability, and you have to put individual workers and small businesses first and foremost.
Right. One other point very quickly, Danielle, and you know, if you could give us some perspective on how serious this is. The Federal Reserve in St. Louis predicts unemployment could hit 30% in the second quarter of this year. The U.S. Treasury Secretary, Steve Mnuchin, he says it will be 20%. But the Federal Reserve said 30%, and that same Federal Reserve branch in St. Louis also said that GDP can drop in the country by up to 50%. How bad is this going to be?
Well, I think the second quarter of 2020 is going to be something that none of us ever forgets in the United States. I can't emphasize enough the fact that putting people in their homes when only a certain percentage of the population has the ability to telecommute is going to be devastating, and we're going to see numbers the likes of which we've never imagined, especially because we've had unemployment at 50-year lows for as long as we've had. This is coming off of the longest expansion in U.S. labor market history and the longest economic expansion, recovery for that matter as well. But I don't think that you can, I don't think that President Bullard was trying to be hyperbolic by saying that unemployment could hit 30%, because those numbers are not unreasonable given the sheer number. Look at the three largest states: California, New York, and Texas. I'm in Dallas, where Dallas is shut down. Cities are starting to shut down one after another. Those are the three most populous states in the United Nations that are largely shut down right now. So it's perfectly feasible to expect a number the likes of which President Bullard suggested.
Right. Leanne, getting back to South Korea, what kind of impact has the outbreak and the efforts that have been made to counter it, what kind of impact has it made on life in the country, especially in a big city like Seoul, where you are?
Well, in Seoul, we have obviously been affected because we're told to practice social distancing, to stay at home as much as possible. Workers have been told to stay at home, and schools are closed, and so children are at home. But we don't see the kind of disruption that we've seen in the United States. So stores are still open, restaurants are still open. There hasn't been panic buying or hoarding like we've seen in the U.S. Again, I think this is largely due to the fact that there has been a lot of information that is available to the public, and this has dispelled and assuaged fears on a wide scale. And so it's quieter than usual, but at the same time, we do see that people are still going about when they need to, but they are being cautious and wearing masks and trying to stay at home as much as possible.
Dr. Miller, one final question, and I've just got a minute for this. This is, of course, an unprecedented situation, and the demands that are being made on the country's healthcare infrastructure are overwhelming. President Trump has ordered, in fact, a Navy ship, a U.S. naval hospital to Los Angeles, as well as medical stations to provide more beds. What else needs to be done?
I think a lot of what needs to be done is already being done. Obviously, hospitals and medical centers are preparing. I feel like it's like the sandbagging before the flood. Some places the flood is beginning to show. But the other key thing we mentioned before is testing. We're a little bit flying blind right now, and that we can't test everyone that we would love to test to truly understand how much is spreading. So as testing capacity increases over time, I think we'll have a better handle of who to treat, who we can send home, who needs the precautions that can save our healthcare workers, masks and gowns and gloves.
All right, and that's where we have to leave it. I want to thank all of you for being with us this evening. That's it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for being with us.